you, Mr. President. Mr. President, I come to the floor today because on Monday, President Obama introduced his new budget. What we saw in that budget is that, for the most part, it's more of the same. More spending, more taxes, more borrowing. And we see this budget from a president who doesn't seem to understand the gravity of the nation's fiscal crisis. When you start digging down into that budget that the president proposed and looking into the Internal Revenue Service component of that budget, what you see is that the Internal Revenue Service is starting to focus in and audit Obamacare. There is a glaring difference in the budget this year from previous years because it is the president's new health spending law. The IRS now has unprecedented power over health care in America. In fact, when you take a look at this budget, and specifically the Internal Revenue Service's fiscal year 2012 budget request, over 250 times, Mr. President, over 250 times, the Affordable Care Act, known in the budget as the ACA, known by people all across the country as Obamacare, is mentioned 250 times. You know, Mr. President, the goal to me of the health care law has been to let for people all across this country get the care they need from the doctors that they want at a price they can afford. As a member of my party, looking at our economy, looking at the deficit, and looking at the incredible debt, what I think we need to do is make it cheaper and easier to create private sector jobs in this country. That's the way we get the economy going again. But when I read this budget, and specifically the IRS requests, it seems to me it's making it harder and more expensive to create private sector jobs in our country. You know, the people of this country are not taxed too little. The problem is that the government spends too much. And when I take a look at this budget, that is exactly what I'm seeing being rejected by this administration. Because it seems that this administration is more interested in taxing, in raising taxes, rather than cutting spending. So when you take a look at what the IRS says in the budget, it says the implementation of the Affordable Care Act of 2010 presents a major challenge to the Internal Revenue Service. This is the IRS talking about the law that was crammed down the throats of the American people in the middle of the night, written behind closed doors. We're all familiar with it. Now it is presenting a major challenge to the Internal Revenue Service. The Internal Revenue Service goes on to say that this law represents the largest set of tax law changes in more than 20 years, with more than 40 provisions that amend the tax laws. The Wall Street Journal reported earlier this week that the budget gives the IRS the ability to hire 5,000 new workers. 5,000 new workers. After taking a close look at the IRS's plans, we know that they will have to hire over 1,000 new IRS bureaucrats, Washington bureaucrats, to implement Obamacare measures. And what are some of those that now we're going to have IRS agents coming and looking into? Well, one is the tanning tax, the component that promotes compliance with the new excise tax on tanning facilities. The IRS is requesting another $11.5 million and requesting 81 more full-time equivalents to go ahead and implement this tanning tax. For oversight, they call it strengthened oversight of exempt hospitals. Mr. President, these are tax-exempt hospitals, hospitals that don't pay taxes. But to do an oversight of these hospitals, they want another $9.9 million and another 84 full-time employees. In information, a new health coverage information reporting, they want $34 million and 100 new full-time employees. Something I call Obamacare 101, assisting taxpayers in understanding the new provisions. The IRS is requesting $22.2 million and hiring another 150 full-time equivalents. And then, of course, the call centers, the IRS call centers, so that if someone has a question, they can call in, ask a question. They want another $15 million because of the complexity of this new health care law that's going to be difficult for people to understand. You know, the American people and small business owners, and those are the job creators of this country, Mr. President, they want the IRS to make their lives easier, not tougher, not audit their health care choices and their health care decisions. But adding hundreds of new jobs, millions of dollars to the IRS isn't going to make care better. It's not going to make care more available for anyone. So I'm going to continue to come to the floor with a doctor's second opinion to fight to repeal and replace this health care law, and to do it with patient-centered reforms that help the private sector, not the IRS, create more jobs. You know, Mr. President, this morning we had a little event called Wyoming Wednesday, where people from Wyoming who are here come together in Senator Enzi's office, and we have coffee and donuts and visit. And one of the people here from Wyoming said, you know, I saw a sign and it was worrisome. I said, what was the sign? He said, it said that this location where they're putting in offices used to be a parking lot. You know, when you're replacing a parking lot with more offices for more Washington bureaucrats, that's not a good sign for the rest of America. So here we have the IRS saying that they're dealing with a major challenge because of the health care law. It represents the largest tax law change in more than 20 years. More than 40 provisions are used to amend are being amended in the tax law, and to go after things that they want this kind of money to implement the tax changes with regard to the indoor tanning services, 81 new full-time equivalents. And you know, you say, well, what's involved in this? Well, the IRS says there are as many as 25,000 businesses that provide indoor tanning services that they're now going to tax, including about 10,000 businesses that offer tanning services along with other services such as spas, health clubs, and beauty salons. Well, I mean, it's so interesting. We're standing here in the United States Senate, we're standing here in Congress, 9% unemployment in this country, people looking for work, and more government jobs are being created, and these people are creating government jobs to make it harder on small businesses. And it gets right to the crux of it right here, because the IRS even says these entities, all these tanning entities, typically do not have experience filing federal excise tax returns. So what's the government going to do? Come in, make them file claims and forms they don't have experience with. It's going to be costly, going to take time, going to be taxed. That's not a way to create new jobs. It's so interesting to look at this whole issue of they want $10 million more to spend to strengthen the oversight on tax-exempt hospitals. Mr. President, these are tax-exempt hospitals. Why are the American taxpayers being asked to pay another $10 million to hire 84 full-time equivalents to deal with tax-exempt hospitals? Well, because according to the law that was crammed down the throats of the American people, the IRS is now required to review at least every 3 years the benefit activities of tax-exempt hospital organizations, which number about 5,100 in this country. They actually say in the budget request by the IRS as part of the President's budget that was submitted on Monday, it says these are new requirements for tax-exempt hospitals, which include a majority of hospitals in the United States. So we're going to increase taxpayer dollars, going for more IRS auditors, and making it harder and more burdensome on the tax-exempt hospitals in terms of paperwork and what they need to do. It goes on and on, Mr. President, and that's why the American people are fed up with what's happening in Washington. And you know, you look into the President's budget, and before getting to the one part that has to do with the Class Act, let's talk a little bit about that, because there's a whole component of the budget wanting 30 staff members added to the Health Department office overseeing implementation of what's called the Class Act. It stands for Community Living Assistance Services and Supports. Well, the President's own debt commission. Remember, the President appointed this commission about a year ago to say, let's look into the debt. And people thought that was a bold move, bipartisan group, a lot of people coming together to take a look at this debt. And for a year, the president said, well, we have a debt commission looking into this, so he didn't deal with the debt. And then now that the debt commission came out with its report in December, the president has mostly ignored it. But yet the debt commission, it was bipartisan, chaired by Erskine Bowles, a former chief of staff of the White House for Bill Clinton, and Al Simpson, a former senator from my home state of Wyoming. They came out and they took a look at the health care law and specifically honed in on this Class Act, which one of the members of this Senate, a colleague on the opposite side of the aisle, someone who voted for the health care law, called a Ponzi scheme that Bernie Madoff would be proud of. The President's Budget Commission, the bipartisan Budget Commission, looked at it, and they have significant concerns about the sustainability of the program and called the program to either be repealed or reformed because it is not sustainable. They have raised concerns. People on both sides of the aisle have raised concerns. But yet, the Secretary of Health and Human Services has in her budget money for 30 additional staff members added to the health department offices. Why? To go over the details of this act that people say ought to be repealed, because, as it says, the details of the Class Act they want to spend $93.5 million informing and educating people about the Class Act. Well, I can tell them right now, it's unsustainable, it's irresponsible, and it's something that should be repealed. But yet the Department of Health and Human Services wants to spend over $93 million of taxpayer money to inform and educate the public about this component of the health care law that people on both sides of the aisle think needs to go away. Now, Mr. President, finally, I will tell you today, as someone who believes this health care law is bad for patients, bad for providers, the nurses and doctors who take care of those patients, and bad for the taxpayers, that what we saw in the President's budget that came out Monday, coming out for next year, asking for over 1,000 new IRS agents to go ahead and implement the various components and responsibilities that have been put upon their heads by this health care law. This is only the beginning, because the entire health care law doesn't really come into full play until 2014. And that's when Americans are going to have more IRS agents, more money being spent, looking into their own personal lives, looking into what kind of insurance they have. Is it acceptable to the government? Is it government approved? And that's why Senator Graham and I have introduced a piece of legislation called the State Health Care Choice Act, to let states decide. Let states decide if Washington ought to be telling the people in their states that they must buy, that every individual must buy government-approved insurance. Let the states make that decision. Let the states opt out if they'd like. Let states decide if everyone in their state, all the businesses, must provide government-approved insurance to their workers. Let the states decide whether Medicaid, a program for low-income Americans, which is being expanded significantly by cramming 16 million more Americans into Medicaid, which governors all across the country in a bipartisan way are saying our states can't afford this. When a New York Times story shows pictures of Jerry Brown from California and Andrew Cuomo from New York complaining about the mandates that Medicaid is putting on their states, the additional weight and the burden on the people of their states in terms of taxes, in terms of the mandates and what it's going to do for the people of the state who are trying to educate their kids, and the cost and the pressure on education dollars because they're getting shifted to Medicaid, the cost of dollars shifted away from public safety, from firefighters, from police officers, other public safety officers. This health care law, I think people at the state level ought to be able to decide that, no, we don't want this to apply to us. And that's why, Mr. President, I come today again as a physician who practiced medicine in Wyoming for a quarter of a century, took care of thousands and thousands of patients and families, trying to help people get better, all in a way that now I think is being taken in the wrong direction by this health care law, and why I think we want to continue to look for ways to make sure people get the care they want from the doctors that they need at a price they can afford. The health care law that was passed by this body fails in all of those respects, and now we see with the President's budget a request for money for another 1,000 IRS agents, not to help people get better, not to help people get the care they need from a doctor they want at a cost they can afford. No, not at all, but to audit the health care of the American people. Thank you, Mr. President. I yield the floor.